Hello, thank you for joining me. I'm Dr. Erica Onibola, pharmacist for close to 10 years. Today I'm talking about allergies and allergy season in particular. So before we get started, please like, share, and subscribe to my channel. Again, please like, share, and subscribe so you can be in the know about upcoming topics, things of that nature. So I wanted to talk about allergies. Allergy season is right around the corner. Um, Pollination of trees, all of that, insects, all of those, even mites and pesticides will begin to burrow and grow. So, with that being said, I want to talk about allergies and what to expect, what to look out for, what is available, what happens with the immune system when allergens are detected in the body. First of all, allergens are microscopic, usually, or they're dust. Could be dust, or it could be insects. So, with that being said, allergies they initiate a response in the blood system by initiating cell proliferation or growth of certain cell bodies to fight against them. And so when that occurs, the body detects these allergens and begin to grow the immune system to defend the body against symptoms and so forth. That will happen after the attack against those. And because of that, the allergens that are detected are eradicated from the body as waste, and then the body will begin to produce symptoms to help even rid the body even more through allergies, such as watery eyes, watery nose, stuffy nose, sometimes headache, increase in body temperature, things of that sort will occur. So um, that is the immune response. And so, to help the immune response, we have medications that are over the counter and that are prescription that will help aid in the defense, which will help to increase the production of immune cells and these monoclonal type entities that help attack directly. So once that is done, again, the body can produce symptoms to help even more rid of those allergens. Allergens can be again insects. It could be pollen because of the pollination. It could be also not only that, it could be insects such as cockroaches that are in the home. They love moisture and food particles. It can also be, besides pollen, it could be outdoor or indoor allergens. And it could be dust as well. And then also can enter into the eyes and cause conjunctivitis or swelling and redness of the eyes. It can enter into the mucous glands, which will aid or which will cause a runny nose and so forth. It can enter into the throat to cause coughing and salivation. It can also get into the skin and cause rash, like the ivy, poison ivy allergen, other allergens that are that are manifested by contact, skin to skin contact. So do be aware of that as well. Now, there are some anti-allergy agents that are available. Some have been taken off the market, some are still on the market. So we'll go over what's available, and that can be either formulation of cream and ointment. It can be solution form. It can also be capsule or tablet, and then there also can be nasal spray as well. Nasal spray. So the triamcinolone or Nasacort is a steroid, and we know steroids are very particular, and we have to really monitor for side effects of steroids. But steroids are medications when given once a day can help fight against allergies because the immune system has um, different directions as to how they come against the allergen. So you might have one direction coming one route, you have another direction coming another route, but ultimately the goal is to fight the allergen. And because we have different routes, we have different medications that can go into another one route or the other to help aid in the defense. Okay, so with that being said, we have the corticosteroids, we have montelukast, we have fluticasone as well. We have the Claritin, and we have the excuse me, Claritin. We have the also Allegra, and some of these products do contain Sudafed, or they may contain a second agent such as phenylephrine. Pseudoephedrine and phenylephrine, they help with nasal congestion. They help to open the passageway so that the passages can be opened and reduce symptoms of headache, reduce symptoms of congestion as well. And then we have some that have been recently taken off the market, so I won't mention those, but we have liquid forms as well that can be given for cough and sneezing. Those type medications can be with like phenylephrine or pseudoephedrine, and then codeine as well. And those help with cough, and again, the codeine helps with cough. And then we have the also medications that help with with increased salivation, help to reduce that and reduce the watering of eyes. We have medications that help reduce watering of eyes and runny nose, and that medication is our active ingredient is going to be your dextromethorphan. Okay, and your dextromethorphan is going to help dry up those symptoms. Then also there's medications such as I went over phenylephrine, I went over pseudoephedrine, dextromethorphan. Acetaminophen helps with pain. Acetaminophen is the Tylenol generic, and it helps with headache and so forth. And besides that, we have dextromethorphan, we have diphenhydramine, which is an antihistamine, which works along a different path to help fight. The antihistamine helps fight the coughing and the sneezing and the allergy, inflammation and redness. So it helps bring those down to where it's more tolerable. Then we have diphenhydramine, we have oxymetazoline, I believe, oxymetazoline, which is a nasal, again, like phenylephrine, a nasal decongestant that helps with that as well. So if you have allergies annually, then it's good to keep up with over-the-counter medications that you like to take, as well as prescription medications. Prescription medications can be like your actuation, or your medications that come in pumps for breathing treatment, for asthma related, emphysema related. And allergens can exacerbate those symptoms as well of asthma. So do be on the lookout for that. So if you have an asthma, of your asthma patient or know someone who is, allergy season can exacerbate or cause increased side effects of that. Okay, so just be aware of that as well. So if you're on a pump or a inhaler system. Also, those machineries or that help with breathing treatments, those can be utilized as well. Breathing treatments and your pumps and your inhalers are also good. And I'll do a second video which will talk about in more particular the strength and the dosing of the active ingredients that I mentioned, which is the diphenhydramine, the pseudoephedrine, phenylephrine, which is going to be your diphenhydramine, your dextromethorphan, your oxymetazoline, also medications for itching, and your corticosteroids are good for itching. They come in ointment form, and they also come in not only ointment form, they also come in so not solution, but they come in creams and ointments. And the ointment is better um, for redness and inflammation caused by like mosquito bites or insect bites, allergens that get in the skin and cause irritation. This also the ointments are good for that, and it helps repel moisture and liquid from getting from removing the ointment. And then also there's creams as well that help cool inflammation and redness and against insect bites or allergens. And those creams are good, but they don't last as long because they don't stick to the skin or adhere to the skin as well as the ointment does. So do be aware of that. We went over the nasal sprays. We went over the eye ointments, which help with redness and inflammation or conjunctivitis. And then there's liquids for the nose as well, to help with allergens and nasal sprays as well. And then there is medications that are topical. There's poison ivy um, creams or salves as well that are out there and that are available when dealing with the outdoors. Because when you go outdoors, you might be exposed to, again, leafy type materials such as poison ivy or oak that might cause allergens. And do be aware there are sunscreens that are available that contain zinc, and UV sunscreen is good with the SPF of 50 or above is good as well. So do look out for those when going outdoors. When you're indoors doesn't always stop allergies, but they help to contain some of the allergens that are outside. But if there's like insects and maybe pesticides such as mice or cockroaches, then yes, do be on the lookout for potential for allergy and medications that might be available. Okay. So I am Dr. Erica, and if there's any other comments or that you may have, please leave them for me. Any other topics, I'll be happy to go over those with you. Thank you for joining me. Have a good day. Bye bye.